Erectile dysfunction, ED, is a common yet often misunderstood condition that affects men of all ages. While its prevalence increases with age, many younger men also experience difficulties maintaining an erection. Tadalafil, a phosphodiesterase type 5, PDE5 inhibitor best known under the brand name Cialis, has revolutionized ED treatment by offering long-lasting effectiveness and dosing flexibility. However, misconceptions about how it works, fears about safety, and confusion about dosing schedules can lead to misuse or unnecessary anxiety. This comprehensive guide clarifies what Tadalafil is, how it works, different dosing strategies, common myths, safety considerations, and tips for maximizing benefits. What is Tadalafil and how does it work? Tadalafil is a prescription medication approved for treating erectile dysfunction and benign prostatic hyperplasia, BPH. Unlike topical or mechanical devices, it works at the biochemical level. Sexual arousal triggers nerves to release nitric oxide in the penis. This molecule activates an enzyme that produces cyclic guanosine monophosphate, CGMP, causing smooth muscles and penile arteries to relax, allowing blood to fill erectile tissue. An enzyme called phosphodiesterase type 5, PDE5, degrades CGMP, ending the erection. Tadalafil temporarily blocks PDE5, prolonging the action of CGMP so that the erection can be maintained. It does not, however, initiate erections. Adequate sexual stimulation is necessary to start the process. Think of Tadalafil as holding the on switch in position once it is turned on, not flipping it on itself. Without psychological and physical arousal, no erection will occur. On-demand versus daily dosing. Tadalafil's long half-life, approximately 17.5 hours, allows for two dosing approaches. On-demand dosing involves taking a higher dose, typically 10 to 20 milligrams, at least 30 minutes to 2 hours before sexual activity. Its effects can last up to 36 hours, earning it the nickname, the weekend pill. This method suits men who anticipate sexual activity within a certain window and prefer to take medication only when needed. Daily dosing uses a lower dose, usually 2.5 milligrams, taken at the same time each day. By maintaining a steady state of medication in the bloodstream, daily Tadalafil provides continuous readiness for sexual activity, eliminating the need for planning and reducing performance pressure. For men in long-term relationships, or those who value spontaneity, this approach can be life-changing. It also has an additional therapeutic indication, treating the urinary symptoms of benign prostatic hyperplasia. Daily dosing may improve urinary flow and reduce discomfort from an enlarged prostate while simultaneously enhancing erectile function. Discuss with your healthcare provider which dosing schedule aligns with your needs, medical history, and lifestyle. Some men start with on-demand dosing and switch to daily dosing if they desire more spontaneity or if they have concurrent urinary symptoms. Others may use a combination approach, taking a daily dose and occasionally adding an on-demand dose for special occasions. Any combined regimen should only be undertaken with medical supervision to avoid excessive dosing. Dispelling common myths. Myth 1: Tadalafil is addictive. Unlike substances that cause physical dependence, Tadalafil does not produce cravings or withdrawal symptoms. However, men who use it recreationally may develop psychological reliance, believing they cannot perform without it. For those using it to treat genuine ED, it functions as a medication to address a medical condition, not a crutch. If concerns about dependence arise, speak with a healthcare professional to explore underlying psychological factors. Myth 2: the body develops tolerance to Tadalafil. The mechanism by which Tadalafil works does not change over time, so your body does not become used to it in the way that tolerance develops to some medications. If the medication seems less effective, the underlying cause of ED may have progressed. Conditions such as diabetes, hypertension, or atherosclerosis can worsen and require adjustment of treatment or addition of other therapies. Regular health checkups can catch and address these changes early. Myth 3: Tadalafil harms your heart. Tadalafil is a vasodilator and can slightly lower blood pressure. In healthy men, it is generally safe. The primary safety concern arises when Tadalafil is taken alongside medications containing nitrates, e.g., nitroglycerin for angina. Both drugs widen blood vessels, and together they can cause a dangerous drop in blood pressure. Men who take nitrates should never use any PDE5 inhibitors. Aside from this contraindication, Tadalafil has not been shown to cause heart attacks or other cardiovascular problems when prescribed appropriately. Some men experience headaches, flushing, stuffy nose or back pain due to the vasodilation, but these side effects are usually mild and diminish over time. Always discuss your cardiovascular health with your doctor before starting the medication. Managing side effects and interactions. Common side effects of Tadalafil include headache, facial flushing, nasal congestion, and muscle aches. These occur because the drug widens blood vessels in other parts of the body besides the penis. They often resolve on their own and occur less frequently with daily low-dose therapy. Taking the medication with food does not significantly delay or reduce its effectiveness, which distinguishes Tadalafil from some other PDE5 inhibitors. Serious side effects are rare but warrant immediate medical attention. Seek help if you experience chest pain, a sudden decrease in vision or hearing, or an erection lasting more than 4 hours, priapism. Priapism can damage erectile tissue and requires urgent treatment. Men who take alpha blockers for high blood pressure or prostate problems should use Tadalafil cautiously, as the combination can lower blood pressure excessively. Always provide your healthcare provider with a complete list of medications, including over-the-counter drugs and herbal supplements, to avoid harmful interactions. For example, certain antifungals, antibiotics, and seizure medications can alter Tadalafil metabolism and may require dose adjustments. Maximizing the benefits. 1. Follow prescribing instructions. Take Tadalafil exactly as prescribed. Do not exceed the recommended dose and allow adequate time for the drug to reach peak effect. On-demand doses may take up to 2 hours to fully absorb. 2. Address underlying conditions. ED is often a symptom of broader health issues. Managing high blood pressure, high cholesterol, and diabetes improves both cardiovascular and sexual health. Maintaining a healthy weight, exercising regularly, quitting smoking, and limiting alcohol intake support vascular function and testosterone production. 3. Consider mental health and relationships. Anxiety, depression, relationship conflict, and past sexual trauma can all contribute to ED. Cognitive behavioral therapy, couples counseling, and sex therapy provide tools to improve intimacy and confidence. 4. Stay informed. Beware of online miracle cures. Tadalafil is an evidence-based therapy with known benefits and risks. Choosing legitimate sources for medication and information ensures you make safe decisions. When to seek medical advice. If you experience no improvement after several attempts at the correct dose and timing, contact your doctor rather than adjusting the medication yourself. They can evaluate whether the dose is appropriate, investigate hormonal or psychological factors, or recommend alternative treatments. Options include sildenafil or vardenafil, vacuum erection devices, injectable medications, intraurethral suppositories, and in severe cases, surgically implanted prostheses. Conclusion. Tadalafil is a safe, effective, and versatile treatment for erectile dysfunction and benign prostatic hyperplasia when used correctly. It enhances your body's natural erection mechanism, but does not replace the need for arousal. Understanding the differences between on-demand and daily dosing helps men choose a regimen that aligns with their lifestyle. Dispelling myths about addiction, tolerance, and heart danger alleviates unnecessary fear and promotes informed use. By following prescribing instructions, managing underlying health conditions, and maintaining open communication with healthcare providers, men can maximize the benefits of Tadalafil and enjoy improved sexual confidence and quality of life.